All right, let's get into it. We've got some fascinating material to unpack today about excess deaths. Specifically, what this data can tell us about the impact of the pandemic. I mean, you've provided us with some pretty thought-provoking stuff.
It really does go beyond just, looking at the headlines. We've got official reports from the CDC, some really in-depth research from Nature, and even a bit of insight into how they actually, crunch the numbers.
So it's like we're about to go on a deep dive into the data itself. This is going to be exciting.
It is. It's going to be interesting to see what the data reveals about the pandemic's impact across different regions, age groups, even causes of death. It's not just about the direct impact of COVID-19.
Right, exactly.
Yeah.
I mean, for anyone listening who might not be familiar with the concept, can we start with the basics? What exactly are excess deaths?
Okay, so excess deaths, basically, it's the difference between the number of deaths that actually happened in a specific period and the number we would have expected based on, historical trends.
So it's like looking at the ripple effects,
Yeah.
the kind of unseen consequences that might not be immediately obvious.
Exactly. We often hear about COVID-19 deaths, but excess deaths give us a much broader picture of the pandemic's true toll.
Okay, so in this case, we're not just talking about who died from COVID-19, but also who might have died as an indirect result of the pandemic and all the disruption it caused.
Exactly. Think about the strain on healthcare systems, the delays in getting treatment, maybe even the fear that kept people from seeking care in the first place. Excess deaths kind of help us capture all those indirect impacts.
And that really lets us understand the true scope of a major event like a pandemic.
Right.
It's about seeing the whole picture, not just like the tip of the iceberg.
I like that analogy.
Thanks. Okay, so let's talk about the data itself. The CDC has these excess deaths dashboards, and I have to admit, they're pretty dense.
There's a lot to unpack there for sure. You know what I find really interesting? It's how they break down the data by age group, by race and ethnicity, and even by specific causes of death. It's incredibly detailed.
Right. And they use this algorithm, the Farrington surveillance algorithm, to analyze all those weekly death counts and compare them to historical trends. I mean, that's how they spot those unusual spikes, right?
That's exactly right. It's like they're constantly scanning for anything out of the ordinary.
But the CDC is really upfront about the fact that this is all provisional data and that waiting for incomplete data has its challenges.
Yeah, it's important to acknowledge that.
Right. So that makes me wonder, I mean, does that make these insights less reliable?
It's more about being aware of the limitations,
Yeah.
The weighting process really depends on how timely the data was in previous years, and that might not accurately reflect reporting patterns during a pandemic. Things change.
Of course.
But the CDC, they implement all these checks and balances to try to make sure the data is as accurate as possible.
So they're acknowledging the uncertainty, but also taking steps to, like, mitigate it.
Exactly.
Okay, that's good to know.
Yeah.
What I found really striking was the total number of excess deaths reported since February 2020.
I mean, it really is a sobering figure. It definitely, makes you stop and think. And it underscores the importance of looking beyond those initial headlines, looking at the bigger picture.
And speaking of the bigger picture, the Nature article highlighted the WHO's estimate of 14.83 million excess deaths globally from January 2020 to December 2021.
That's a massive number.
14.83 million. That's like almost 3 times higher than the reported COVID-19 deaths for that same period. I mean, that's a huge discrepancy.
It is. And you know what that tells us? It highlights just how important it is to capture those indirect impacts we were talking about earlier. A lot of deaths connected to the pandemic, they might not have been directly attributed to COVID-19, especially in areas where they don't have as many resources or data collection isn't as robust.
So it's not just about the virus itself.
Right.
It's about the domino effect it had on healthcare systems, on communities, really all over the world.
Exactly. And the Nature article, it gets into these geographical variations, especially in areas like Southeast Asia. They saw a doubling of deaths compared to what was expected right in the middle of 2021. Underreporting is a major challenge when it comes to understanding the real impact.
And even in the United States, the CDC acknowledges that official COVID-19 death counts are most likely underestimates. Makes you wonder what the actual numbers are.
It does raise some questions about how accurate and complete our data really is, especially during a crisis that was unfolding so rapidly. The pandemic exposed some vulnerabilities for sure in how we track mortality globally.
So how does an organization like the WHO even begin to estimate excess deaths in places where, reliable data is scarce? I mean, it seems like an impossible task.
Well, that's where things get interesting. They use these really sophisticated statistical models that factor in things like temperature, containment measures, even the historical burden of disease in a specific region. And they use that to predict excess deaths in those countries where they don't have complete data. It's pretty remarkable.
So it's not a perfect solution, but it gives us at least a glimpse into the global picture.
Precisely. It highlights how powerful data science and modeling can be.
The article also mentions something called p-scores, which I have to admit I'm not familiar with. What are those, and how do they help us make sense of all these global variations?
Oh, key scores. They're really helpful for comparing the impact of the pandemic across different countries because they take into account differences in population size and age structure. Basically, it's the ratio of excess deaths to expected deaths expressed as a percentage.
So a p-score of, say, 50% would mean that a country experienced 50% more deaths than expected, regardless of how big its population is.
You got it. It creates a more level playing field, so to speak, and it reveals some pretty sobering disparities. Like, remember how we mentioned Peru having a P-score estimate of 97%?
Wow, yeah, 97%. That means they had almost double the number of deaths they would normally expect.
It's a complex situation.
Yeah.
And it speaks to the fact that we need to look beyond just the numbers themselves. Consider the unique challenges each country faced, from their healthcare infrastructure to their economic situation, even things like social determinants of health. Peru, for instance, they had a huge strain on their healthcare system and a large informal economy, which made it much tougher for people to isolate and protect themselves.
So those p-scores are really just a starting point,
I'd say so.
a way to identify which countries were hit the hardest.
Yeah.
But the real understanding comes from looking deeper.
Absolutely. It's about connecting the dots between the data and what was happening on the ground.
It's about understanding the human stories behind those numbers.
Exactly. And that's something we'll definitely want to explore more as we continue to dive into these excess death estimates.
I'm ready for part 2. So we've established that looking at excess death data, it can give us a much more complete picture of the pandemic's impact, more so than just focusing on those initial COVID-19 death counts. But we also talk about how that data is constantly being updated, refined. Makes me wonder, how much can we really rely on these numbers, especially while they're still provisional?
It's a good question, and it's something the CDC addresses directly in their reports. They're very open about the limitations, especially when it comes to that weighting process, the one they use to account for those delays in reporting.
Could you maybe unpack that weighting process a bit more? I'm still kind of struggling to wrap my head around how that works, practically.
Okay, so imagine you're trying to track deaths, let's say, in a state where there's typically a lag, maybe several weeks, in how quickly they report those deaths. This weighting process, it tries to adjust for that lag by looking at the current data, but then comparing it to how complete the data was in previous years, at a similar point in time.
So it's like using those past reporting patterns to predict how complete the current data will eventually be once all the reports are in, so to speak.
Exactly, you got it. And here's the catch, timeliness, it might have shifted during the pandemic, right? So those historical patterns, they might not be as accurate anymore.
So that could potentially lead to either overestimates or underestimates, depending on whether reporting sped up or slowed down during that time.
Exactly. And the CDC acknowledges that this is a big challenge. They've got a few strategies to try and mitigate those inaccuracies, though, like using what they call control counts based on demographic info from, death certificates. This data is usually available quicker than the cause of death info, and if that weighted count ends up lower than the control count, well, that suggests there's some underreporting going on.
Okay, so it's like a built-in safeguard to make sure the estimates aren't totally off. Makes sense. But then, why even release these estimates before all the data's finalized? Wouldn't it be more accurate to just wait?
It's a trade-off for sure. Waiting for that finalized data, sure, it'd give a more complete picture, but it could take months, even years, for all that data to come in. And in a situation that's changing so rapidly, like a pandemic, well, timely information, it's crucial, for public health response. Got to make decisions based on what you know at the time.
Right, got to be able to act quickly. It's about making the best choices you can with the information you have when you have it.
Exactly. And the CDC, they're very clear that these estimates are provisional, they're subject to change. As more data becomes available, those numbers might shift.
Yeah.
emphasizes that data analysis, it's an ongoing process, not just a one-time thing.
Okay, so the data's provisional. It's going to be updated. We should interpret it knowing that. But let's step back a sec. Big picture.
Yeah.
What do these excess death estimates really tell us about the impact of COVID-19?
Well, I think they paint a pretty sobering picture, you know. They reveal just how far-reaching the consequences were, more so than those initial case counts or reported COVID-19 deaths might suggest.
It shows us the hidden toll, the stuff we might otherwise miss.
Exactly. Think about it. The strain on those healthcare systems, disruptions in routine care, potentially even increases in deaths from other causes, things that might be connected to the pandemic but not immediately obvious.
Right. It's about understanding those ripple effects
Yeah,
across all aspects of society.
absolutely.
And the CDC's data on, specific causes of death, that provides some clues, especially when we look beyond just the deaths that were directly caused by COVID-19.
Yes, let's go back to those dashboards for a second.
One that I thought was really interesting was the data on deaths from respiratory diseases. So were there any notable increases there, besides those directly linked to COVID-19, I mean? And so what could explain that kind of trend?
Well, it's really important to remember that correlation doesn't equal causation. There's so many different factors that can influence cause-specific mortality. Trying to isolate the pandemic's impact, that can be challenging. But the CDC's data, it definitely raises some questions.
Like what kind of question?
Well, one possibility is that the pandemic, all that strain on healthcare systems, maybe it led to some delays in diagnosing or treating other respiratory conditions, right? Which in turn could contribute to an increase in deaths from those conditions.
It makes sense that something like that could happen during a crisis, when everything's so overwhelmed.
And we also have to consider the role of people's behavior. Did folks avoid going to the doctor when they had respiratory symptoms because they were afraid of being exposed to COVID? That could have also led to delays in getting diagnosed and treated.
That's a good point. It shows how complicated these interactions can be. A pandemic, it's not just the virus itself. It's like all these unintended consequences that can ripple outwards.
Exactly. Public health, it's so much bigger than just containing a single disease. It's about understanding all these factors that contribute to people's overall well-being.
And understanding those factors, it relies on good data collection and analysis, something that both the CDC reports and the Nature article emphasize over and over again.
Absolutely. Without good data we can trust, it's like we're flying blind.
So this deep dive into excess deaths, it's not just about looking backwards. It's also about making sure we're better equipped to handle these kinds of situations in the future.
It's about preparedness.
Exactly. Now, there's another aspect of these excess death estimates that I think deserves some attention. Their potential to, inform those long-term public health strategies, policy decisions, all that.
That's a great point. It's not just about understanding what happened. It's about using that knowledge to build a better future, a healthier, more resilient future.
I like that.
Right. For instance, the CDC's data, when they break down excess deaths by age group, race, ethnicity, it can help us pinpoint those populations that were disproportionately affected by the pandemic.
Okay, so we use that information to create targeted interventions, address those health disparities, try to make the healthcare system more equitable for everyone.
That's the idea. And it's not just about reacting to the crisis. These death estimates, they can also help us figure out how to strengthen our public health infrastructure so we're better prepared for the next health emergency, whatever that might be.
So give me an example. What kind of strategies are we talking about?
Well, let's say the data shows a significant increase in deaths from cardiovascular disease, and there's reason to believe it's connected to disruptions in care because of the pandemic. That might highlight a need to, invest in things like telehealth services for those with chronic conditions, or maybe develop new strategies to make sure people can access preventative screenings and treatments without delays.
So it's about using the data to kind of anticipate what we might need down the road and make sure our healthcare systems can handle it.
Exactly. It's about learning from the pandemic's challenges and then taking action.
Okay, I'm with you.
Yeah.
Now, what about the WHO's data? That global perspective. How can their excess death estimates help inform those international public health efforts?
Oh, that's an important point. And the Nature article, it touched on this, but it's definitely something worth exploring further.
So what can we learn from their data? What does it tell us?
Well, the WHO's estimates, they really highlight just how differently countries around the world were impacted, not just in terms of the total number of excess deaths, but also, those P-scores we talked about, which show the relative impact.
Right. And those variations, they reflect such a complex mix of factors. I mean, everything from healthcare infrastructure to economic conditions, existing social inequalities, even government policies and cultural practices.
You hit the nail on the head. It's complicated, and understanding those regional variations is absolutely crucial if we want to tailor our international public health interventions, figure out where resources are most needed.
So no more one-size-fits-all solutions. We got to get more nuanced.
Exactly. And the WHO's estimates, they can help guide investments to strengthen healthcare systems, especially in those low and middle-income countries that often end up shouldering a heavier burden during pandemics.
It's about addressing those global health disparities and building a world that's more resilient, more equitable.
Absolutely. We have to remember, infectious diseases, they don't stop at borders. Having a strong global health system, that benefits everyone.
I'm sensing a theme here. Connect the dots, recognize the complexities, and use that data to make positive change.
That's a great way to put it.
Okay, we've covered a lot of ground here, but I'm sure there's still plenty more to explore.
There's always more to uncover.
That's what I love about this stuff. And that's why we're going to continue our deep dive in part 3. Be sure to join us as we dig into even more insights and talk about what this all means for building a healthier future.
I can't wait.
All right, so we spent the last 2 parts really digging into the data on excess deaths and the pandemic. And now I kind of want to go back and revisit some of the more technical stuff we kind of glossed over earlier.
Sounds good to me. There are definitely some interesting bits in there that deserve a closer look.
Yeah. One thing that piqued my interest, it was the way the WHO, how they estimate excess deaths in countries where they don't have a complete set of data. The Nature article had mentioned this Bayesian Poisson framework, which sounds a little intimidating, if I'm being honest.
It does sound a bit jargony, but the idea behind it, it's actually pretty straightforward. So the Poisson distribution, it's a statistical tool, and we use it to model events that happen randomly over a period of time, like, for example, the number of deaths you'd expect in a certain population.
Okay, so they're using a statistical model to kind of predict those death counts where the data's missing pieces, right?
Yeah.
But what makes it Bayesian? I mean, what makes that approach unique?
That's the cool part. Bayesian statistics, what it does is it lets us combine what we already know with the new data we're seeing to make a better prediction. It's like saying, okay, we know some things about how death rates normally behave, and then we've got this limited information about a specific country, so let's put those 2 things together to get the best possible estimate.
So it's like filling in the gaps without pretending that we have all the information, right?
Exactly. And instead of giving you just one number Bayesian analysis, it gives you a whole range of possible values, which acknowledges that, there's uncertainty when you're making predictions, especially with incomplete data.
Right. It seems like a much more honest and transparent way to handle this kind of analysis.
Transparency is key, and the WHO, they're really upfront about the limitations and assumptions of their model. They're not saying we know everything for sure, but they're using the best tools available to try and shed some light on this really complex issue.
It's about knowing the limitations, but still trying to get those insights,
Absolutely. It's a good reminder that data analysis, it's a process, it's always evolving, always being refined as we learn more.
Okay, and speaking of insightful tools, we've been talking about those P-scores and how they're used to, compare the pandemic's impact across different countries. Can you just remind me again, why are those P-scores so helpful? What makes them so useful?
Sure. So P-scores, they help us account for the fact that different countries, they have different population sizes, different age structures, and all of that naturally affects their death rates, right? So by looking at that ratio of excess deaths to the expected deaths, we can get a sense of the proportional impact the pandemic had on each country.
Right, so a P-score of, let's say, 50%. That means a country saw 50% more deaths than they would have expected during that period, regardless of their overall population size.
Exactly. It's like leveling the playing field a bit.
Yeah.
And then it can reveal some pretty striking disparities. Like, remember we were talking about Peru? They had that P-score of 97%.
Yeah, that was a really powerful example of just how badly some countries were hit.
Right. And while the P-score by itself, it doesn't tell us why a country was hit so hard, it's definitely a good place to start,
It's a red flag,
Yeah.
like, hey, something major happened here. Let's take a closer look and figure out what factors contributed to this.
Exactly. And those differences in P-scores, it just highlights how important it is to consider a whole bunch of factors when you're trying to understand the impact of a pandemic. Like, we're talking healthcare systems, economic conditions, existing social inequalities, even things like government policies, cultural practices. All of that plays a role.
So we got to avoid those overly simple explanations, recognize that it's complicated.
Absolutely. And the more we learn about how all those factors work together, the better we'll be at responding to future health challenges, whatever they might be.
That global perspective, it really is eye-opening, isn't it? It makes you realize that health, it's all connected no matter where you are in the world.
Definitely. And it's a good reminder that when it comes to something like a pandemic, we're all in it together. A strong global health system that benefits everyone.
And those P-scores, they can help us direct resources, make sure that investments are going where they're most needed.
Precise.
So it's about using this data not just to understand what's already happened, but to try and build a better future, you know, for individual countries and for the world as a whole.
I couldn't have said it better myself.
As we've been going through all this, talking about excess deaths, it's been really striking just how much we can learn about the pandemic's impact, those ripple effects on a global scale. But I think it's important to remember the people behind the numbers.
Absolutely. Numbers are powerful, but they don't tell the whole story.
Right. We're talking about millions of excess deaths. But it's easy to forget that each one of those, that's a person, a family, a community that was affected. There's a lot of loss and disruption behind those numbers.
And I think that's why it's so important to go beyond just the quantitative stuff, explore the qualitative side of things too.
What do you mean by that?
Well, the sources we've looked at, they've given us a really good understanding of the scale of the pandemic's impact, right? But they don't tell us a lot about what it was actually like for the people living through it.
We know how many excess deaths there were, but we don't necessarily know their stories, the challenges they faced, the long-term effects they're still dealing with.
Exactly. And those qualitative dimensions, those are just as important as the numbers themselves. They give us a more complete picture of what those ripple effects look like, how things like mental health, social ties, economic well-being, even cultural practices, how those were affected.
It's about putting a face to the numbers, hearing people's stories, understanding the real human cost of a crisis like this.
And then using what we learn to inform our responses, our policies, how we move forward as a society.
So as we wrap up our deep dive into excess deaths and the pandemic, I'm walking away with a real appreciation for the power of data, how it can guide our understanding of these complex issues, but also a sense of responsibility. It's not enough to just analyze the numbers. We got to do something with that knowledge.
I agree.
We have to use these insights to actually build a healthier, more equitable world, a more resilient world.
That's a great way to put it. It's a call to action for all of us.
And to everyone listening, we hope you'll keep exploring these topics, keep asking questions, and use what you've learned to have those important conversations about public health and the kind of future we want to create.
It's been a pleasure joining you for this deep dive.
Absolutely. Thanks for your insights.